Hi, everybody. This is Brenda Green with the Be Strong Group. We're so excited to have you for another one of our Tuesday chat. Again, I'm Brenda Green with the Be Strong Group. My husband and I founded this nonprofit in honor of our son, Braden, who has sickle cell disease. And our mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. And we wanted to use these Tuesday chats to take an opportunity to talk about topics that are important to those who have sickle cell disease and their caregivers. And a lot of the times, some of our topics applies to everyone. So we're so excited about tonight's topic as we tap into a very crucial period in raising our children with a chronic illness, and that's the transitioning from pediatrics to adult care. And yes, that's a crucial time for really all children, but especially to our families of sickle cell disease. So tonight we have a wonderful guest speaker. And I just want to let you know that the information that we bring to you is for educational purposes only. Anything that's specific to you or the care of your child, please consult with your physician. But we have the amazing Mia Robinson. And Mia is a 38-year-old Atlanta, Georgia native living with sickle cell hemoglobin C disease. Mia has been active in the sickle cell community since the age of 10, where she first attended Camp New Hope, a week-long summer camp for kids with sickle cell disease hosted by the Sickle Cell Foundation of Georgia. Mia loved camp so much that she continued to attend well after aging out, holding multiple positions over the years, from camp counselor to creative arts instructor. Over time, Mia has volunteered and worked closely with several sickle cell organizations, including her own, Sickle Cell Awareness 365. She co-hosts a podcast, Do I Look Sick? Is the program coordinator for the transition program, mentors and participate in advisory boards, creative arts instructor for several organizations, and so much more. I am so honored to welcome tonight Mia Robinson. I met Mia on these social media, well, these advocacy streets, as I would call it. And it's been such an honor to meet her, to talk to her. I'm so inspired by the work that she does in honor of those with sickle cell disease, as well as herself. And Mia, thank you. Thank you for being with us tonight on our Tuesday chat.
Thank you so much for having me.
Yeah. And Mia, we're going to talk about a very important topic, a critical time frame of care for our kids with sickle cell disease with a chronic illness. And that's moving from pediatric care, which is amazing in a lot of cases, to adult care, which may not be amazing in a lot of locations. So I am so inspired by all the work that you've done or you're doing where you are. And I just had to have you on here just to share with our listeners about what you're doing in Georgia and how, some input and feedback you can give to us in our own personal location. So Mia, let you take it over and just tell us about the program that you lead there in Georgia.
So yes, I am the program coordinator for the transition workshops with the Sickle Cell Foundation of Georgia. And it's a little bit two separate elements, but it's pretty much all the same. But we work with the teens and their parents, and then we work with the young adults who have already transitioned into adult care. And what these workshops do is just go over different aspects of transitioning into adult care. We prep them for real life and adulthood with sickle cell disease. And I think with adulthood, we're always learning something. We never get adulthood exactly right, but the things that I've learned and I've experienced myself, as well as I've heard friends who've also been through the process, I want to be able to give those stories and those experiences and tools to the people and the families who are transitioning into adult care. We know that in pediatric care, in a sense, the doctors kind of coddle the kids, and it's understandable. These kids are dealing with a horrible disease that causes extreme pain among a ton of other things. So that care and that closeness is very prevalent in the pediatric care, but in adult care it's a different ball game. Like, you're completely on your own. In a sense, I kind of feel like the kids are thrown out there, and they just have no guidance on how to operate in adulthood with sickle cell disease. So that's what these workshops are for.
Oh, awesome. That is so good because, that's something that, us as parents, now I have a 15-year-old, so we're smack in somewhat of the middle of her at the early beginnings of that transitioning period, and we have to prepare. And that gets a little scary. That's really scary, to be totally honest.
Yeah.
So, just share with us some of the maybe the topics or the recommendations that are covered in each of these in the different workshops. You want to
So
start with the first one?
sure. So, one of the things we talk about, of course, is college prep. And, we do talk about the scholarships that are available for people with chronic illnesses, people in the sickle cell community. But we also really get to talk about the preparation in the sense of talking to the Department of Accommodations, Access and Accommodations, so that they have your information on file. So if you ever need to miss a class for whatever reason, that documentation is already with the Office of Accommodations. So you should be able to get more time on your test if you need it. Maybe you missed some classwork or whatever because you were out sick in the hospital, or maybe you just could not make it to class. That paperwork is there to cover you. We didn't have a program like this when I was transitioning. However, I told my professors, each of my professors, much like I did in high school, hey, I have sickle cell disease. I can't always say, hey, I'm not going to be here this day. I can't always give you a heads up on what's going on with me. So, in the case that I miss class or I miss work, this is what's going on with me. So, that was my way of kind of getting ahead of it instead of looking backwards and saying, hey, well, I was in the hospital because such and such. They already know, they already have the paperwork. Another thing that we talk about with going into college is locking your medications up. It's very sad that, people take these prescription drugs recreationally. And I don't know what people go through to make them want to try it, or I don't know, I don't judge. However, you could be held liable if someone else gets access to those medications. And you might come across classmates if they know what you're taking. Ooh, can I try it? Ooh, how much you want to sell it for? You don't want to get caught up in that because you can get yourself in a lot of trouble. So we definitely, that's one of the things that we talk about, is to lock up your medications, have your support group on campus. That one trusted friend that you can trust with, hey, I'm not feeling well today. Can you get me notes? Or, hey, can you even take me to the emergency room? But find that trusted friend that you can share your information with, that can help you along with your journey in college. Um, some other sessions, because college may not be for everybody. So we do talk about the workforce, and I share my experience with that as well. And, some jobs have FMLA, Family and Medical Leave Act. So you have that certain amount of hours that you're able to take if you're sick, if you need that time for doctor's appointments, have those things in place. At one point, I would even just straight up tell my managers, hey, like I did my professors, this is what's going on with me. I can't always give you a heads up about when I'm gonna be out. I can do my best, but I can't do it 100% of the time. And granted, you don't have to be detailed or specific with what's going on with you. However, giving them that heads up, they can appreciate that more because you've come to them and say, hey, this is what's going on. That's not to allow them to limit you. That's not because they're being nosy. It's just to let them know what's going on in your status and what may happen, as sickle cell is super unpredictable. So those are two of the topics that we've discussed with the transition clinics, the transition workshops. I'm sorry.
Okay. And those, and I'm glad there's, you mentioned, college isn't for everybody. That's not going to be everybody's choice of
Mhm.
future, and it doesn't have to be. So you have college and a workforce workshop or session.
Mhm.
Now, do you have, are there any young people, and I've spoken to some young people who have been afraid to mention about sickle cell disease because they feel that it may be held against them. Is there a portion in that workshop where you kind of empower them with the information that, number one, that's illegal? Well, they can't hold it against them. Can you talk a little bit on that as far as the content towards young people?
Yeah. So I have run into adults that are still ashamed in a sense to tell people that they have sickle cell because they don't want pity, which I understand. They don't want to be limited to I've heard people say, well, if I tell them, then they're only going to think I'm only capable of so much. No, hold me to the same standard as you would everybody else. I may not be able to do it like them, but it can still get done. So we do talk about just being empowered with sickle cell disease. It does not have to be a death sentence. You do not have to limit yourself because of sickle cell disease. You can do whatever it is you want, but it does take planning. And like I mentioned, just with the workforce, just having that paperwork ahead of time, someone you trust with that information. It's much easier if you have a job that has FMLA. That way you can just fill out that paperwork and not really have to worry about anything else.
Mhm.
Um, it would be a courtesy if you told your manager or whomever what's going on, but you aren't required to tell them. But in any situation, you are your first advocate. You have to be your self advocate because sometimes you have to fight by yourself. Your parents won't always be there, those friends won't always be there. And even with this COVID stuff going on, a lot of us are spending time in the hospital by ourselves.
Mm.
They're not allowing, at one point they weren't allowing any visitors to come in there with us. So moments like that, we really have to advocate for ourselves, know what works for us, what doesn't, and be able to speak on those things. And you don't have to be nasty about it, you don't have to be disrespectful, but you should be assertive and firm in what it is that you're explaining to whomever you're talking to about your disease and how it affects you.
Oh, wow. This is some good information. And I want to just remind anybody who's listening, if you have any questions, just put them in the comments and we'll be sure to answer them for you. And we can see them. So, Mia, you shared the two types of workshops. Are there any that maybe for the younger, the beginning period of this
Transition.
transition?
Yeah, so we start off with like the very basics to make sure they understand what sickle cell is and the science behind it. Like what's going on inside your body. You know, some of us just know that we have sickle cell. For me personally, I want to know what's going on. What are my cells doing? What is the blood doing? Maybe that's my fascination for human anatomy. I don't know. But it's important for our overall health to know exactly what's going on in our body. We talk about what the causes of pain are. Inflammation, stress is the number one trigger. So just because you're not an adult doesn't mean you don't experience stress. You're dealing with peer pressure at school. You're learning yourself at that age. You're going through puberty. Um, you still have to worry about finals and class and everything else. So knowing that stress is a huge trigger can hopefully redirect some of the pain that we feel. We do talk about nutrition. I know how teenagers are. They want to eat junk, the flaming hot Cheetos and the Takis and the pizza. That's good every now and then, but that catches up with you. So we talk about nutrition and how to just eat a better balanced, have a better balanced diet. Um, we talk about being in cold temperatures and just other causes of pain. A lot, I didn't know how altitudes affected me until I got on the plane for the first time, or
Mhm.
I climbed Stone Mountain, and I didn't know at that time that the altitude affects us. So I had to learn the hard way. So these type of things are the things that I share in the workshops. That doesn't mean that you can't fly. It doesn't mean that you can't climb mountains. I probably wouldn't. That's just me, but I would still love to fly. We teach them about planning and preparation to do really anything. Even just flying, it takes a lot of planning and preparation. Go and get those fluids, or make sure you're super hydrated for days, maybe even weeks up to your flight. Make sure that you have all of your pain medications. Make sure that you have an emergency plan from your doctor saying, okay, this is the normal medications that this patient takes when they're in crisis. Their counts are normally this. But just having your doctor have something laid out. So if you're traveling somewhere, take that letter and they'll have a better idea on how to treat you. So those type things, um, just learning themselves, learning how to navigate the things that they want to do while living with this disease. And that can really start at any age.
Okay. Yeah, and that's one question I was going to ask you. What is the typical? I mean, you've given so much information here, and the key part is educating.
Yeah.
A lot of the things you mentioned that are being mentioned at these workshops are things that the role of mom or dad is doing in the beginning as the main advocate or the voice of that child, but they're going to grow up.
They
And
are.
so, what is the age you would suggest that this transition period began?
So to really start, like really diving into it, I would definitely say about 13 or 14. Um, learning about sickle cell should always be talked about no matter what age. But once they start getting a little bit of independence, 13, 14 is really when we should start talking to them about just making sure they understand the disease, making sure they understand their bodies, learning to say, or learning to call yourself to refill your medications. When your medications are out, the phone number is right there. So just learning how to do those things. If you normally get a transfusion every month, allow the child to call and make those appointments yourself. And sometimes it's hard for the parents to sit back, because even my mom is guilty too. She's learned as I gotten older, but there are still times that, like, especially if I'm traveling somewhere, I feel like she feels I need a babysitter, and I'm like, I'm okay, mom. So that's just the mama in you.
Yeah, yes.
But it's a learning process for the parents as well. It's not just transitioning for the kid, but it's also transitioning for the parent. So, and learning to live outside of that box, I think at times people limit us or keep us in this box because we live with sickle cell and because we can get sick so easily. But a lot of times we have to learn on our own, you know. It might not be fun all the time, but we that's the only way we'll learn, because just hearing our parents tell us or someone else tell us, we may not always pick up on it right away. We have to experience things. So I do encourage them to live outside of that box, experience things. You might get sick and it's okay. It won't be the first time and it won't be the last, but don't allow yourself to be stifled um by sickle cell. Don't let it limit you.
And that's a great message. And we're so grateful for everybody listening tonight. Again, we're talking to Mia Robinson with Sickle Cell Awareness 365. She's talking to us about the transitioning from pediatric care to adult care and some of the efforts she's making and things she's doing in Georgia. And she's sharing it with us, sharing some good gems. We got a couple of comments saying enjoying this empowering and impactful conversation. This is a great conversation, Mia, and some important information. So I see that there are some mamas that I'm aware of that are listening who have younger children. My son is 15, so we're in the middle of this. But I understand the portion where you mentioned this is a big deal for parents as well.
Yeah.
Because up until this point, we've been the voice. And I can speak for myself, my husband, we played, team, we're a team, but, I know all the doctors, I know all the medications, I know when the appointments are and things like that. So transitioning that over to the kids, that can be tough. That can be, that's it's a need. It has to happen because they're going to grow old,
Yeah.
even though we want them to stay babies, but they're going to grow old and they have to know to speak up and advocate for themselves. But before we continue on, Mia, we do have a question. Do you want to
Sure.
let's read it? Okay. Brianna asks, how can we best support those with sickle cell who are transitioning into adulthood?
So one of the things that I also talk about in the transition workshop is for the patient to establish a care plan. So this care plan would include what you need as the patient when you're in that moment of crisis, for one, because we're not in our right mind. We're kind of panicky when we're having a crisis. Sometimes I don't want to talk to anybody. I don't want to deal with anyone. But sitting down with your loved one with sickle cell, or if you're caring for someone with sickle cell, just creating that plan so that everyone knows what to do when it's time to move. Having that bag prepared is super crucial. Whatever you like in your hospital go bag, put it in there and just keep it ready on go at all times. We know how unpredictable things can be with sickle cells. So at 2 o'clock in the morning, we might have a crisis and we have to go. Also, as the parents, you can kind of go into coach mode. So you're coaching them on how to do it, especially if they've been in the back seat for most of the time. Coach them. Okay, this is your doctor's name. This is what he specializes in. This is why you have to see this specialist. This is the medication that you take. This is why you take the medication. This is what the medication is doing for you. So things like that, really going into coach mode and teaching them about sickle cell disease and what they have to do with sickle cell. Why these are your normal counts, your hemoglobin, your retic, knowing those things. So working as a team with your loved one in that transition period. And even though at 18, they're kind of off on their own, we still gonna need y'all. We still need y'all. We still need that support. Just allow them to take that front seat, because sometimes parents, they help and think that they're helping, but sometimes they're in the way, or it's not really helping, it's doing the opposite. So ask how can you help, because what may be helpful to me may not be helpful for Braden or anyone else, so just having that open communication at a time that they're not in crisis, and that in a good space, sit down and have that conversation and create that care plan with them so that everything is already in place in the moment of crisis.
Very, very, very good question. Very good response and recommendations. We have to allow them to lead as a parent, allow them to lead and ask them what we can do to help. So, those are some good pointers. And as parents, we go into that coach mode to coach and, guide and teach them and then let them take the lead.
Yeah,
Want to take another question?
sure.
Okay, so we have a question from Jacob. Um, what are some new challenges COVID has brought upon kids going off to college and ways that they can overcome those?
That's a really good question. First of all, take this COVID thing seriously. I know it's crazy, and some of the information that's out there can be very conflicting. You know what's best for your body. As much as I was unsure about the vaccine, I did get vaccinated because I don't want any extra problems. We already have an immunocompromised system, so we don't need any additional problems outside of sickle cell. You can also request, if they're considering you being with a roommate, you can request to have a solo room, and you can have that documentation saying, hey, I have sickle cell, or I'm in the immunocompromised population. I need to have my own room, because really we don't know what else these other people are bringing in, what other kind of germs or whatever it is. So in order to stay safe, definitely um, ask about having your own room. With me, I'm at Georgia State, so I have the option to take virtual classes. Even though they're doing in-person classes, I feel more comfortable taking online classes. So if that is an option, definitely take advantage of it. That way you don't even have to worry about being around the other people. Even if you can maybe take half of your classes being online, that way it limits your exposure. Of course, stay away from large crowds. Continue to wear your mask, even if you are vaccinated.
Mhm.
It's just that's just because we don't know. I don't think other people are being truthful with their vaccination status or even with their COVID status. So just to cover yourself, keep your mask on. I don't care if you're vaccinated or not. Keep it on. Keep hand sanitizer in your in your pocket, in your purse, in your backpack, all of those things, and make sure that paperwork is in with the Office of Accommodations, so that if you need anything, that paperwork is there.
Great. That was a great question and great response and advice, and especially that communication with your college, with the appropriate offices to make sure the accommodations are in place because the services are there. We just, you just have to ask for them or request them.
Yeah.
So that's a good part. And, that's even something, especially that COVID question with our younger, my team going into high school and hopefully face to face, that's something that's of a concern. You have to have frank conversations
Yeah.
um, with him. I've already had it in prep of going back. Okay, we know you need to go back face to face to get the instruction that you need, to get the social things that you need. But here's what you have to do
Yeah.
so we won't end up in the hospital.
Right. And we have to be, COVID has really taught me and many others to be assertive in our boundaries, because people don't really understand the severity of what we deal with and how easily it is for us to catch things. So it's okay to be like, hey, fist bump or elbow bump or whatever, but you have to set those boundaries in place for yourself. A lot of the people, well, I won't say a lot, but there are some people who don't really have an understanding of what's going on with you, and are not considerate of your boundaries, those same people probably won't take care of you when you're sick. They
Mhm.
probably won't come and see you in the hospital. So, if they feel a certain way, it's okay. But you have to stand firm in your boundaries. And if they ask any questions, be open to telling them. And hopefully they're asking for understanding and not just to be nosy. But that's just a part of advocating as well. Okay, I need you to keep your distance because I deal with this. I don't want anything you got. I don't care if they, well, I'm cool. I got vaccinated. I don't have COVID. Okay. I don't know that.
Right.
So it's okay to set those boundaries. And if it's someone that loves you and really understand, they will get it. They will respect that boundary. If they don't respect that boundary, then they probably don't need to be in your circle in the first place.
Oh, good point. That's a good point. And I think, even how you talk about the workshops that you've organized and are leading, I think the key to being able to be more assertive and more confident in your advocacy position as a young person, transitioning person, is that education piece.
Yeah.
You have to have, and that education kind of aids with the empowerment, aids with that confidence, because you know your whys, you
Mhm.
know what would happen and the what ifs.
Mhm.
So, empowering them with that knowledge, that's life saving,
It
to be honest.
is. And as long as you live, you're going to be learning more things about sickle cell disease. Um, as we age, I tend to say that we age a little bit faster than everyone else. Um, so you're going to always be learning things. You're going to always be educating and advocating for yourself, because even going into adult care, you may run into doctors that really don't know about sickle cell disease. And we're limited on the doctors that we can see because of that. So you may see a new doctor and you have to explain to them what's going on with you. So to a certain extent, it's kind of unfortunate that we always have to be in that advocate mode, but it really could be life or death.
Absolutely. Absolutely. And you guys, again, we're talking with Mia Robinson. She's with Sickle Cell Awareness 365. She works for is it the Sickle Cell Organization of Georgia as well?
Foundation of Georgia, yeah.
The Foundation of Georgia, and she is talking to us about the workshops and the things that they are offering to our young people from this transitioning period from pediatric care to adult care, and sharing the education to our young people to prepare them. Mia, can you share? I know I've heard in discussions some of um, the stats as far as the quality of life or the health once a young person, let's say, they turn 18 or 21 and go off and say, okay, mama's been in control all these years. Um, I'm on my own, yay, freedom.
Mhm.
Can you kind of elaborate on some complications or some issues that come about as to not be fully prepared for that transition?
Yeah. So we don't always feel what's going on with us. Just period, sickle cell or not. We can't always feel what's going on, but it's important to stay continued treatment with, if you have different specialty doctors as a pediatric patient, get referrals to the adult version of those specialty doctors. For instance, I've been seeing a retinal specialist since I was 16 years old, because the type of sickle cell I have can affect the retina. So I see a retinal specialist every 6 months. And for me, that means I could go, and if I were to not go, they can't see when the blood vessels or the cells are acting up in the back of my eye. And if it's not monitored, that could cause blindness in my eye. So there, some sickle cell patients deal with acute chest syndrome, which is problems with the lungs and kidney issues and heart issues. Those things have to be monitored. You want to stay on the preventative side of things. Instead of something happening, you kind of panic and figure out where you need to go, and they're kind of working in reverse. So continuing to see these specialty doctors is really preventative treatments for anything that may go on. The doctors can pick up on things that we don't have access to. If I could do my own x-rays at home, I would. And sometimes I feel like I can draw my own blood. I think I've got that down pat, but I don't have the tools to run the test or to really see what's going on or anything like that. So we encourage the teens and the young adults to continue seeking treatment. Don't allow it to lapse, because again, you don't want to work backwards. You want to stay ahead of whatever may happen. And just knowing overall sickle cell education, you can kind of be aware of what things might happen. I have hearing loss due to sickle cell, and it's been there for a while. However, I honestly just really start seeing someone about the hearing loss to the point that now I need hearing aids. And it could have been prevented had it been pinpointed when I was younger. So even with AVN, some sickle cell patients have AVN. I've been dealing with AVN in my left hip since I was 16 years old again. Don't do what I did, because they gave me a cane to walk with. And at 16, I was like, I'm not walking with the cane. I'm not walking with the cane. It did make it worse, along with, an unhealthy diet and just being overweight. That just all made it worse. So don't do that. Use the tools that the doctor is suggesting to alleviate any extra pain, or to prolong any type of damage that could be done due to sickle cell. So the key is just to stay on the preventative side of things instead of being reactive towards it.
This is some great information, and I have some people in agreement. A fellow mom of a warrior, Danielle, said, "Thanks for the information. This has been very informative for me," and and that's why I wanted you to come talk to us, Mia, because I think what you all are doing in helping to provide that extra education, not only to the young warriors, but also in the parents, because we have a very important role in that transition too. We got to let go and, coach and let them lead. And so you've discussed the role of the young person. Can you mention the role of the physician, the specialist, the pediatrician in our child's health care? Are they a part of these workshops or education, or how do you implement those?
So yes, we usually have a pediatrician and an adult hematologist. I'm not sure if you're familiar with Dr. Ekman. He is responsible for creating the Sickle Cell Center at Grady's Hospital here in Atlanta. So he usually comes in and talks. He usually gives like the COVID updates and what we need to know. But we do have a pediatrician that comes and coaches in areas that the mentors can't really inform about. We even have a counselor, a child psychologist on hand, because we do talk about mental health as well. I feel like anything that's going on up here, the body feels almost immediately. For me, it's almost immediately. So we want to get some control over our mental health before our body follows. So we definitely have a child psychologist to come and talk again, adding to the conversation towards her specialty, where the regular pediatrician or the mentors aren't able to really dive into. For our young adults, we've had someone to come on and talk about Social Security and disability, because that's a reality for some people. And it can be very confusing. For me at 38, it's confusing. Medicare, Medicaid, disability, it's all confusing. So we have someone talk about how to get that information transferred, how to sign up for insurance, what you need to look for with insurance. For me, I had insurance through my job, and I always got the highest plan because I know how I am. It can be pricey, however, it's absolutely worth it. So those type of things, and having those physicians there and those specialists there, really add to the conversation. It's like I said earlier, it's a team effort. Teamwork makes the dream work. So we can't do anything without that team there. And that conversation with the doctors has to be a two-way street. That doesn't mean to allow the doctor to overpower you and just throw stuff at you. And that doesn't mean we just overpower the doctor. We have to have a mutual agreement, a mutual relationship in order for it to work best for us.
Oh, absolutely. This is I can't I'm keep repeating myself about this is such good information. So for those who may not have an established program or workshops like you all do there, what are some resources that you can recommend to parents of young children, or even for young adults right now who may be listening to us tonight?
So one of the websites is Got Transition, and that's really for anyone with a chronic illness. It's not specific to sickle cell, but Got Transition is a website that has the resources and tell you step by step on what you should be preparing to do at whatever age you are. There are resources for the parents that the parents should know on how to help their child transition into adult care. The Sickle Cell Foundation, we do those workshops every other month. Our next one is actually in October because September is going to be super busy. So our next one is in October. You guys can follow my page on Facebook, Sickle Cell Awareness 365, to keep up to date on the dates. So that you can just kind of tune in. Each workshop that we do gives different material. It kind of plays off of the latter or whatever is going on in that time. So don't think that you missed the last one. It's the same stuff. It's completely different stuff. We have new information to give at each time. I also want to kind of go back with the college prep. One of the things that one of my friends talks about in her transition to college, especially if you are interested in going away for school, make sure that you have contacted the doctor near your school. See if you can set up some type of consultation or visit when you go and visit the school. Get a referral from your pediatrician in that area, or just period, get a referral from your pediatrician because a lot of them are in network with each other. Um, so have that plan out if you're thinking about going away for school. And I know the parents could be like, that's too far. I can't get to you fast enough. It's okay. Just have that plan in place so it'll comfort your parents just a little bit. It probably won't do much, but just a little bit. Just have that plan in place.
Oh, yes, Mia, that's some good information. And we did mention, Mia mentioned gottransition.org is a good resource for both the young person as well as the parent. And it's some valuable information, not for those of us who have children with chronic illnesses, but, for all really, because our babies will grow up
Yeah.
and we are their voice, we are their advocate. So it has a lot of good information on there about the transition process. And you can definitely find Mia on you can follow her about information about the workshops that they're offering. She'll have some good uh, information. If you follow her under Sickle Cell Awareness 365 on Facebook, I was going to send the link, and I add the link in the comments. So thank you, Mia. Is there anything else you want to share that you feel is important that we know?
So if you guys are interested in maybe starting something like this in your area, definitely contact your children's hospital, your physicians. Stay on them about it, because they might just kind of, especially with everything going on now, um, they might kind of put it in the back of their mind and, get sidetracked with other stuff. But this is super important for our kids, our babies. So stay on them about creating something. If you need me to come out and talk, or just come on virtually and talk about it, I'm more than happy to do it. But with some things, you might have to be the catalyst for starting it, because people are just so caught up with other things, and this may not be at the top of their list. However, you might be in that position where you really need some help, and you want to see things like this be available for in your area. So be that advocate to make sure these type of workshops are done in your area. Get as much information as you can from gottransition.com org, I think it is. I'm sorry.
Mhm.
Um, but get as much information as you can from the sickle cell community, um, and just be the advocate in making sure this gets done in your area.
Oh, this is great. I do know, like, in our here in Columbia, we have in our children's clinic, we do have some amazing physicians and specialists there who, have been trying for years to put together um, some good processes in the transition part. And we also, I'm fortunate to be a part of a task force that has been organized with the state of South Carolina to develop a sickle cell state plan that has some good information. And one of the parts is to include, we acknowledge that there need to be more of a concerted effort around transition. So we have the pieces there. We just need to put them all together. And I think, like you mentioned, we have to work as a team.
Yeah.
It's going to take, the physicians and the specialists and the people maybe in a government platform, but also us as advocates, to add our voice to it, to add the why to all this is why this is important. So thank you so much, Mia. And again, you can go and follow Mia. This is the link. I shared it in the comments, so you can click on it and go and hit follow or like or whatever it is on Facebook. You guys are on Instagram as well. So
Yes.
find them on Instagram and follow you guys. They always have a wealth of information. The podcast she mentioned earlier with some great information if you just want to learn more about sickle cell disease. So um, thank you, Mia. We have some people saying thank you for this information. Thank you, Deneen, for listening and commenting because this is very good information and we appreciate you. So before we sign off, Mia, is there anything else or last words you want to say as far as on this topic? A message you want to leave with um, the parents or the young people that are listening tonight?
Yes, just allow sickle cell to empower you. Um, Live beyond the box that people try to put you in because of sickle cell. As long as you plan what you want to do and how to operate, you know, you might fall, and it's okay. That's not because you have sickle cell, that's just life.
Mhm.
So don't allow it to keep you down. Do what you can when you can. We might not be able to run a mile out the gate, but we take baby steps in anything that we want to do. It can happen. You can accomplish whatever you want. Just have that plan and know your body.
Absolutely. Mia, thank you. And you
You are.
guys, I just have to add, got another thank you. Thank you. You were very informative. Thank you. Um, But y'all, Mia is very talented as well. So you definitely need to follow her. Um, and she will be a part of, we have our 8th annual Warriors Convention coming up at the end of the month from the 25th through the 29th. And I'm so excited to be partnering with Mia to share some uh, to introduce us, our nonprofits, to network with the people in our region, in our area on the 25th. So we're so excited. I'm ready for the paint and chat.
Yes, the paint and chat. And I'm also doing the young adult track. So in that young adult track, we will be goal setting with vision boards. We will be discussing financial literacy, and how to be financially independent because disability may not be for everyone. And we're talking about self-advocacy and setting those boundaries. So definitely come and join the convention. It's got something for the parents too, and the trait track it's going to be amazing. So yeah.
It really is. You guys can go ahead and register. You can go to sickle cell convention dot is it .org?
Yeah. Yeah.
Yeah, sicklecellconvention.org and go ahead and find out more information. And you can register online. If you have any questions about scholarships, the Be Strong Group has some scholarships to offer to anybody who wants to register and attend this event. It's virtual. So you can learn, listen, have fun, get some good stuff right in the comforts of your own space. So join us. Join us. You can follow, you guys follow me, and now you're following Mia as well. So join us and register for this conference. Again, Mia, thank you, thank you, thank you. Thank you to everybody who has listened. Thank you for those who are listening on the replay. If you have any more comments or questions for Mia, please go ahead and put them in the chat and I'll make sure she sees them and we'll get you an answer or a response or an acknowledgement. But we appreciate you. So thank you, Mia, for allowing us to use your knowledge in order to share with those who are listening and to take part in our Tuesday chat. So until next time, which will be next Tuesday, you guys, we have a really special guest next Tuesday as well, as we do every Tuesday. But we're so excited about next Tuesday's topic as well. So until next time, we'll see you guys and you be safe. Good night.